Okay, we're good. So as Katie said, my name is Katie MacDonald, and I am the Director of Operations for Miles for Migraine, and I am also the Director of Federal Policy for the Alliance for Headache Disorders Advocacy. Today, I'm here to talk to you about making advocacy a part of your treatment plan. And I just have to get my mouse working. There we go. So I'm going to tell you a little bit more about who I am. I'm going to tell you about how I found advocacy and kind of what I've learned, what advocacy means to me. And then I'll share a few resources with you, different places you can go and types of events you could get involved in if you're interested in becoming more engaged in advocacy. So as Katie said, I am a person living with migraine. I have had migraine since I was 14 years old. I am what gets described as highly functioning. This is, these pictures that you're looking at on the screen are all pictures of me in all different places all over the world doing different types of activities. I think I'm smiling in most of them, but what is common about all these pictures is I have a migraine in every single one of these. For me, when I look back at pictures, it's actually like an instant reminder. I can remember the specific attack. I remember how I was feeling. I remember questioning what I was doing. But I guess probably there's a couple key tricks I have in my tool bag at this point after living with migraine for so long. And I think FOMO, the fear of missing out, is probably one of the things that drives me the most. I wake up every day with a migraine at this point, but there's too much happening in my life that I want to be a part of, that I guess I just got to the point where I decided I could either stay home on the couch and in bed, miss out on activities, be in pain and be upset about what I was not doing, or I could, and this is as much as possible. There's always exceptions to every rule, but in general, I've decided I just want to try to get out there and do what I can, show up, and I'm probably going to pay a price, and I'm going to be in even more pain after I'm done with that activity, but I'm still out there and taking part, and I get to enjoy the experiences of being around my friends. And I can't do this 100% of the time. There's times I have to cancel things, but even though I am highly functional, that doesn't mean I'm not highly impacted by migraine. Like several of you on the call today, it has made huge impacts on my life, on my relationships, on my career. But I think I have chosen to do the best I can with kind of the cards I've been dealt and try to make a difference both for myself and for others. I have been chronic for the last 10 years, and in the last couple of years, unfortunately, it kind of keeps getting worse. And as I mentioned, I have migraine attacks every day now. I have a migraine right now. This morning, I was kind of grumbling about, how was I going to do this presentation? I feel awful today, but I probably look relatively normal to all of you, and I'm here. I've been through quite a journey, as I'm sure many of you on this call have, with lots of different treatments. I have tracked away, anything that can be tracked. I keep track of my attacks and the medicines I take. And, I don't get super detailed. I don't track the weather and what I eat anymore because I don't think that's helpful. But you can't say, as again with many of us, that I haven't given it my best shot. For many years earlier in my diagnosis and my journey with migraine, I would describe myself as a really frustrated patient. I was probably difficult to deal with because I didn't understand this disease. I didn't have reasonable expectations around what it meant to live with migraine and how difficult it was to get rid of migraine. I had to kind of come to terms with the fact that it was something I was going to have to live with and figure out how to cope with. I'm one of those people that's probably tried over 70 different treatments, medications, prescriptions, supplements. I feel like I could open up a migraine museum with all the different devices. I've got, green lights and rose-colored glasses and slightly different shade of rose-colored glasses and armbands and headbands and things you put on your neck and ice packs and shots you take in your arm and your thigh. And it's great. There's so many things out there. But unfortunately, I just haven't found the thing that works for me from a treatment perspective. I think what I did figure out, though, is that advocacy has actually been one of the best treatments for me. My advocacy path started out, initially advocacy to me meant having the assertiveness to call my provider's office when things weren't going well and try to share my story and help them understand why I needed help. Advocacy meant calling my insurance company to try to understand why they wouldn't prescribe me more than 2 Imitrex injections a month. And unfortunately, the hard part about this type of advocacy is the times when you need to do it are often the times when you feel the worst. Having somebody, a friend, a family member in your corner that's willing to help you out, help you think about your thoughts, or maybe even make calls on your behalf can be really helpful as you're starting out and trying to advocate for yourself. I engaged with, I found there was a patient advocacy office at our medical center. So there was a time where I felt like I wasn't being heard and I wasn't getting the responses that I need, and I needed more voices in my corner. And so I found this patient advocacy office and reached out to them to see what services they offered. I also realized that advocacy meant I needed to start educating myself about this disease. When I see my provider, my headache specialist, I get 15 to 20 minutes with them at a time every couple of months. That's not enough time to talk about, my symptoms, the treatments, and, everything that there is to be known about migraine. I had to take responsibility for that myself. I found the first book I found was written by Terry Robert, who is one of the original advocates in our space. And I read this book, and then from there I started finding blogs and websites. And, this is over 10 years ago, before the blogs were more common. But I started identifying other resources and feeling less alone by finding other people who were in similar situations. I have the advantage of having an amazing headache specialist. You just heard from him, Dr. Shapiro. He is, the model of advocacy, and he's probably a big part of what fueled my interest in advocacy. But being able to talk to him about it, I started several years ago before I really got to know Dr. Shapiro. I would often add, one of my questions during my visits would be, what is going on? What treatments are being worked on? What's happening? And he started explaining to me about how he got involved in advocacy. And, he was frustrated as a provider that he couldn't provide the treatments that his patients needed. And so he figured that advocacy was the way to go to try to make change at a big, national level that could ultimately impact patient care. And as Dr. Shapiro was teaching me about the type of advocacy he did, he talked about Headache on the Hill. And I always thought, for several years, I was like, wow, that sounds so amazing. You go to DC and you talk to members of Congress, and it's all these providers there, like, wow, what a dream. I wonder if that would, if I could ever do something like that. I thought it was like beyond my wildest dreams. And then one year, Dr. Shapiro asked me if I'd like to come. And I think this was 6 years ago. He invited me to come to DC and go to the meetings to meet with our Vermont representatives and senators. And it was, as Katie Moran said, it was really life-changing for me. It just was such a unique opportunity to be together with, for me, this was the first time I was in a place with other people who had migraine and headache disease. People were talking out loud about needing to take medication and how they were going to get ready for the next day, knowing they were going to have a migraine attack. I'd never been around something like that before. And I was just really impressed that, like, during the training, you had a provider and a patient sitting right next to each other, and they were going to be on the same team the next day. And it just seemed like such a novel concept. And once I did it, I was just, like Katie said, I was just hooked and knew I wanted to get more involved in stuff like this. After Headache on the Hill, to go to Headache on the Hill, you have to be able to, you don't need to know a lot about politics. You just need to know how to share your story. And you want to be able to do it effectively, but almost like elevator pitch style. So you have to be able to share your story in a short, succinct, engaging way so that you can get the attention of your members of Congress without telling them, your whole life story and every treatment you've been through. And after having that experience, when I came back from Headache on the Hill, I remember I wrote this really long email that I ended up sending out to some of my coworkers, some family members, some friends who I may have mentioned that I had migraine, but they really didn't understand what it meant or how much it impacted me. And I shared with them what my experience was at Headache on the Hill and a little bit more about how migraine was impacting my life. And the response I got from that was actually, really warm and encouraging. And that, I think, combined with the Headache on the Hill experience, really gave me the confidence to start sharing my story more. And that is advocacy, being able to speak up and share what you're going through. A career change. Katie mentioned this. I actually had to leave my career. I was in IT and management for an IT company, and the daily migraine was just too much on top of a very demanding career. And so I took a long-term leave of absence. And after that, I still wasn't feeling better. I wasn't feeling like going back in the office was going to be the right thing for me. And so I left, and, I wasn't working. I was volunteering during that time. I started volunteering with Miles for Migraine. And ultimately it led to a new job for me, a new career, actually. I started working for Miles for Migraine. And then I actually started also working for AHDA and organizing Headache on the Hill. And over the years, I've grown my learning, my knowledge about policy, and gotten really excited about that. Advocacy is also, I think, the kind of next level of advocacy after you are able to share your story is becoming a resource for other people. So you don't have to have all the answers. And I don't recommend, necessarily imparting your opinion on every person you meet with migraine. But you'll start to find that, you're in a conversation with somebody and they mention, they don't say they have migraine, but they say they have, headaches a couple days a month, and they feel nauseous and everything is so loud. And, I can now gently say, just have you talked to your doctor about this? It's possible you have migraine. And they're like, oh, no, migraines, that's horrible. I don't have migraine. But you become, as an advocate, you start being able to share resources and share information with others and help them in their journey towards diagnosis and treatment and feeling better. So what I'm hoping to share with you is that advocacy it's kind of a journey. There's many steps along the way in this advocacy journey. And it takes on all different shapes and forms. Advocacy is not there's not one thing that makes you an advocate. There's all different types of things you can do. So why do I feel like advocacy is the path and that advocacy should be a part of your treatment plan? For me personally, and I think for a lot of other people, advocacy just gives purpose to a disease. It helps you feel like you're not just living with these symptoms and feeling awful all the time, but you're doing something with that knowledge and that experience. Advocacy helps connect people with common interests. I mentioned, that first time I went to Headache on the Hill, being in a room with other people that understood and lived with, similar situations. And whether it was a doctor or a patient or a researcher or a caregiver, we all had the common interest of wanting to improve the current situation in terms of treatments and stigma around migraine and headache disease. Getting involved in advocacy lessens the feelings of isolation. It improves your, for me, I'll say it improved my ability to function. I just started to feel a little more confident. I started to feel like I had more control. You don't have a lot of control over migraine. It does what it's going to do. You may have triggers, but in general, it's just going to hit when it wants to hit. It's not always convenient. In fact, it's usually not. But having advocacy in your life gives you something else to focus on besides the pain. I also think the more that we talk, the more people understand what this disease is. And really, it's the only way we're going to find a cure. So I just want to share next a few different advocacy opportunities with you. Miles for Migraine. I'm going to talk mostly about Miles for Migraine events. We have our Walk, Run, Relax events. These are they're not about exercise. We are strong proponents of movement. We think movement matters. It's important to our health. But we understand some people are not feeling well enough at any given time to go for a walk or a run. So these are called Walk, Run, Relax events because you can choose which type of activity is best for you, including relaxing. We just want you to show up, wear a Miles for Migraine shirt, and be seen and let the public know that, if 200 people are willing to gather in a park on a Saturday for migraine and headache disease, maybe we should pay more attention to this. And ultimately, if we're doing this 25 times a year and we're getting thousands and thousands of people to better understand, that's advocacy. Miles for Migraine also has community and support groups. So these are great opportunities. They're virtual, so you can join from wherever you are. We have them every day of the week except for Friday at various times of the day and night. They're great moderated sessions. It's not just a show up and talk about how awful you're feeling. These sessions are led so that there's a topic of discussion and we talk about advocacy and we talk about stigma and we talk about getting more involved and helping each other out. I've heard lots of stories about people becoming friends through these groups. And over the last couple of months, we've introduced a couple of special groups. We have one for teens. As Katie mentioned, we just started our Men with Migraine support group. And there's a new one for parents who have children with migraine. Katie also mentioned at the beginning of the session today that we have the Advocacy Stories Project. This is an opportunity for you to share a story about advocacy. All of these people you see at the bottom of the slide have shared their stories. You can find them on our website if you're looking for inspiration about what advocacy is or how people have experienced advocacy. I strongly encourage you to check those out. We also have a new program called Act Now Training. This is a 8-month long program where we meet about once a month and do some training for patients and providers to learn about stigma and advocacy and ways to get involved. We feel like it's really important to educate more people on becoming advocates. And ultimately, these people who participate in ACT Now go on to attend Headache on the Hill. It's a great opportunity to work on a specific advocacy project too. And then Headache on the Hill. You heard a lot about that from Dr. Shapiro. Katie's mentioned it. I've mentioned it. I think a lot of people who talk about Headache on the Hill, those who have been will say in many cases it's a life-changing experience. It's not what I would recommend as a first step in your advocacy journey. It definitely is a grueling event. It takes, except for last year, we're in DC, we're walking around. It's a full day. You're meeting with people in person. I always end up having horrible migraine as a result, but the FOMO thing, it's worth it to me. And that experience of working together as a team to change federal policy is amazing. Like I mentioned, you don't need to be a political guru. The requirements really are that you can share your story. We like to see that you've done some type of advocacy before Headache on the Hill, that it's not your first advocacy event. But we will train you, we'll teach you what it is you need to do to speak to your members of Congress, and you bring yourself, you bring your experience. For those of you who are interested, check out the AHDA website. And if you sign up for our newsletter, you'll be the first to get notified when we open up the application process in the fall. It'll probably be November that we open up the applications for this year, and Headache on the Hill will take place in February. We are planning to have both virtual and in-person options for 2022, so that should make it more accessible for more people. And finally, just a couple resources for you if you're new to advocacy. I kind of see it as almost like a stepwise progression. CHAMP, the Coalition for Headache and Migraine Patients, is a great first place to start. Their website has a lot of information about the different types of headache disorders, about treatments, about working with insurance companies through denials. A lot of good resources there, and those can be some initial steps in advocacy. If you're ready to come out to a live event or even virtual in this new world, Miles for Migraine hosts over 50 events a year. So there's something out there for you. You're here today, you're at an education event. And then kind of higher level is getting involved with AHDA and Headache on the Hill type advocacy. And here, Dr. Shapiro had a similar slide. These are many of the groups in our space today in the migraine and headache disease advocacy world. Each organization offers different programming, different tools, different resources. So I encourage you to follow them online or check out their websites. And in summary, I just encourage you to find a way to include advocacy in your treatment plan. It is going to be the thing that helps lead us to a cure. And in the meantime, hopefully it helps distract you from your pain and contribute in a different way. Thank you very much. If there's any questions, just let me know, or we can do those at the end.
That was awesome, Katie, and very, very inspiring for all of us. Does anybody have any questions for Katie? And if not, for me, advocacy started probably 2.5 years ago when I started working for Miles for Migraine as well. For you on here, I felt like I was alone in migraine, and probably a lot of you that haven't started an advocacy process might feel alone as well. And advocacy is, as Katie said, your first step to not feeling alone. So if you haven't started your advocacy, it is so important, and you will see that you aren't alone. And my first experience was a Miles for Migraine walk, and just standing there with 200 people that were like me was life changing as well. So hopefully you will join us. And Katie, it was very inspiring, and everyone said thank you so much for sharing your story. We really appreciate it.